Since being declared a global pandemic back in March of 2020, COVID-19 has spread rapidly throughout the world. Within less than a year, we already have a vaccine rollout. Naturally, a lot of us have questions about these vaccines. We are joined today by two Mi'kmaq doctors to discuss the COVID-19 vaccines.
So hello everyone, my name is Shante Blackmore. I am from Millbrook First Nation and I'm a recent medical graduate from the University of Western Ontario. I'm currently working in Halifax as a Dalhousie Medical School family medicine resident. So I'm just happy to be here and share some information with you all today.
I'm Dr. Robert Johnson from the Millbrook Mi'kmaq First Nation. I'm a certified family physician, emergency physician, and anesthesiologist, currently practicing in British Columbia.
Before we get started,
we want to send a huge thank you to Shante and Rob for taking time out of their busy schedules to meet with us to discuss the COVID-19 vaccines.
We would also like to say that this video is not meant to pressure any individuals into getting the COVID-19 vaccine.
Instead, this video is to be used as a resource to share credited information,
so you can make an informed decision as to whether or not to get the COVID-19 vaccine.
We highly encourage everyone to do their own research using credited websites like the ones we have shared alongside this video.
When researching, you may also want to consider a few other factors,
like our elders, our families and communities, ceremonies, gatherings, and most importantly, your own health.
Whether or not you get the COVID-19 vaccine, please remember to wear your mask and practice social distancing,
so we can end this pandemic together. Walaliek.
Is how do vaccines work, particularly the COVID-19 vaccines, and have they been deemed safe for us to use?
Going back to the basic coronavirus, we all see this round virus with a bunch of spikes around it. The spikes around the virus allow the virus to get into a human cell. So what the vaccines are creating are antibodies against that spike through genetic technology that will not change our core genetics. It just allows our body to create antibodies against the spike protein, therefore preventing disease.
Are side effects common with vaccines, and what type of side effects can we expect after getting the COVID-19 vaccine?
Some of the more common side effects that you might see with the vaccine, probably most commonly is just a local reaction at the site of the vaccination. Some redness, some swelling, and some pain in the area. And then, side effects that you may also experience include tiredness, headache, muscle pains. You may spike a fever and have some chills. But those are considered very mild side effects, and we typically treat those, with just supportive care, making sure you're resting, staying hydrated, and taking Tylenol for the fever and aches.
It's important to note that these side effects are common side effects. It does not mean that you've contracted the disease. It specifically means that your body's having a mild side effect because your body's working to make antibodies against COVID-19.
Exactly, and that's where you would get potentially a more pronounced side effect profile with your second dose, because as I said, with the booster shot, you have your initial antibody creation, and then with your booster shot, it's much higher. So you tend to see potentially more side effects with your second dose. And it's unfortunate, but it's actually also fortunate because you're creating those antibodies.
Can I still get COVID-19 and pass it on to other individuals if I'm fully vaccinated?
So yeah, the chances of acquiring COVID-19 after vaccination are very low, but not zero. However, if an individual does contract COVID-19 after having a vaccination, the seriousness of the illness is very low, and the viral spread is very low, meaning the chance of you passing on to another individual is much lower if you already had a vaccine.
And I know that there is a lot of concern with the new emerging variants that we are seeing that are having increased or, that the vaccines are less efficacious against. And so that's another concern as well. And so really the solution to that is having as many people vaccinated earlier on, and not allowing for the progression of the virus in our communities, to allow for these mutations that create the new variants and allows the virus to kind of learn how to evade our current efforts to prevent the virus.
There are multiple COVID-19 vaccines available, all of which have different efficacy rates. So Pfizer and biotech is 95%, Moderna at 94%, AstraZeneca at 70%, and J&J at 66%. Can you provide us with some information around the efficacy rates of these vaccines, and can we use these efficacy rates to compare them to one another?
I don't think we should get caught in a numbers game. I think specifically we have to just understand that each of the vaccinations that has been approved are very efficacious and in general very safe. But specifically when it comes to these numbers, what they mean by 95% effective, basically in the Pfizer biotech study, 95% less people that received the vaccine became infected with COVID in comparison to those who did not get the vaccine. But in fact, the true number is that 0.04% of people within the studies became infected with COVID-19. That's 4 in 10,000. So the number they chose maybe didn't quite represent how truly effective the vaccines are.
After doing some of our own research, we found that the Pfizer, biotech, Moderna, and J&J trials were all completed at different times, locations, and with different variants across the world, ultimately affecting the efficacy rates that we see today. Is that true, and can you provide us with any further comments?
It's very important to look at, as scientists, to look at different variables that can affect the statistical outcome of research, specifically on the vaccines. So your point is very important, that different vaccine trials were done at different times. And those different times do reflect potentially higher levels of disease in the community or variants. That's why we should not focus on numbers. This should not be a number game. We should just generally understand that all the vaccines are very effective.
And what is the difference between mRNA vaccines and viral vector vaccines? And does the difference between these types of vaccines affect the efficacy rates that we see?
What we can basically say is, and I'll almost quote verbatim the National Advisory Committee on Immunizations. This committee, scientific committee, now nationally recommends that the mRNA vaccinations be given as first shots and second shots. And that's specifically because of the increased instance of clotting that occurs in 1 in 73,000 people with the viral vector vaccines, which is the AstraZeneca vaccine. So in general, that's the very updated recommendation as of 2 days ago.
Pfizer, Moderna, and AstraZeneca require 2 doses, where J&J only requires 1. Can you elaborate on why this is?
Reasoning behind having 2 doses for pretty much any vaccine is that generally they require what we call a booster, just to increase the levels of antibodies that our body is creating in response to the vaccine. And so when these vaccines are being developed, it determines basically how well the protocols work and whether or not a booster is required. And so with Pfizer, Moderna, and AstraZeneca, it was just deemed necessary to have a booster. So with the initial vaccine, you can get a rise in your antibody levels that might begin to kind of trail off. And then with the booster, with the second dose, you'll have a larger increase in your amount of antibodies. And so you're just more protected after the second shot.
We definitely recommend this vaccine video that we linked right here. It has great graphics and full in-depth explanations on the vaccine efficacy.
can you explain to us what herd immunity actually is and what is the difference between natural immunity versus vaccine immunity?
So I think that this question is really important for our Mi'kmaq communities, especially, and our larger Canadian population as well. I think because essentially what herd immunity is having a large enough proportion of our population vaccinated so that the virus has a harder time circulating throughout our community. So some individuals in our communities are unable to have the vaccine, or because of diseases or other illnesses, they may not have competent enough immune systems to fight off the virus if they were to contract it. And so if a large proportion of our communities are vaccinated, the virus will have a harder time moving around our communities, and therefore a harder time infecting people who aren't able to have a full immune response to the vaccines, or individuals who just aren't able to receive the vaccine.
That's excellent. I think just to add to that, this is where the community has to act as one. So the purpose of herd immunity should result in the whole community becoming protected. So as each individual becomes vaccinated, then the community becomes stronger and more protected against COVID-19.
So is an immunity from a natural infection stronger than immunity from a vaccine?
At this point in time, we are unsure if natural immunity is any better. And in fact, some experts are guessing that it might be less effective than vaccine-induced immunity. And another important comment that was made by experts in the field in immunology was that the risk of actually contracting the disease is so much higher than any common side effects from actually getting the vaccine. So when you put two and two together, getting the vaccine will not only create better immunity, but then number two, you're not getting serious disease or death or long-lasting effects from COVID.
Have these vaccines been deemed safe for women who are currently pregnant or trying to get pregnant?
Initial studies did not include pregnant women. Mm-hmm. However, studies are emerging. Mm-hmm. And the current recommendation by the Canadian committees, including the National Advisory of Immunizations, state that pregnant women should be offered the vaccine at any time before, during, and after pregnancy, as it's deemed extremely safe.
I think that one thing that I would add to that as well is that when pregnant women receive the vaccine, there is some potential for the baby to receive passive immunity in the womb. But when a woman receives the vaccine, they may, and continues to breastfeed, they may provide some protection to the fetus and the newborn. So it may offer some further protection to a baby who isn't actually eligible to receive the vaccine.
Yes, and the most current evidence when it comes to antibodies passing into the neonate, it can offer protection for at least 6 weeks after maternal vaccination.
Many young Indigenous women are feeling hesitant about getting the vaccine. Is there any advice as a medical professional that you could give that would provide them with some comfort?
The best way to put it is, if a pregnant woman or a woman that wants to become pregnant contracts COVID-19, that individual could potentially have long-lasting, serious effects on the body. And the risks of getting the vaccine are far less than getting the effects from the virus. And this is a question that is really less scientific, but I guess utilizing more emphasis on empathy and understanding that people have doubts for many reasons. from history or from side effects from other medications or stories of potentially other people having issues with either people or medications. So I think we have to understand that people are hesitant and respect that. However, we don't want our people getting sick or dying from the vaccine. And currently, the evidence says it's extremely safe.
Yeah, exactly. Just to echo what you're saying, Rob, I know a lot of our communities are very critical of the healthcare system, and that is completely understandable, which is, one reason that we wanted to do this is because, we understand the history, we understand the hesitancy that people have with engaging with Western medicine. And so we are using that lens to think critically about the interventions that we are proposing for our communities. And this is something that we do deem as a safe medical intervention.
Heart disease and diabetes are its own epidemic within First Nations communities. Such diseases and other underlying medical conditions, including medications used to treat those underlying medical conditions, can make our people at an increased risk for severe illness if they contract COVID-19. So our question for you today is, if individuals do have an underlying medical condition, has it been deemed safe for them to receive the COVID-19 vaccine? And is there any potential changes or updates that support individuals who do have underlying medical conditions?
So I would say that in individuals who have underlying health conditions, for the most part, this would mean that you are, especially with diabetes, you actually are at higher risk of having more severe disease if you were to contract the virus. And so it's absolutely safe for you to get it, and definitely recommended to receive the vaccine in those cases. So these are one of the reasons why our communities are at risk, are at such higher risk of COVID, because we do have such a significant burden of disease in our communities, which impacts our ability to fight off these infections. And so that's why vaccination is so important in our communities, and it's definitely recommended.
Basically, if somebody is on an anti-rheumatism medication that can affect their immune system, the current recommendation is that we still offer the vaccines to these individuals. However, that individual should go to their primary care provider, and there are recommendations that are specific to the medication. And there are some medications that you may have to delay taking around the time of the vaccine.
And this just goes back to our discussion around herd immunity. So people who are immune compromised and who are on these these drugs that can, cause their immune systems to not be working in the same way that, someone else's immune system would, is the reason why it's important for our communities to get vaccinated. So that these are the people who we are protecting when, the whole community comes out to get vaccinated. We like to think about our, getting vaccinated as being a personal choice, but it actually has really deep effects on the entire community. And when we get vaccinated, we actually are doing our part to protect our elders, our community members who have autoimmune diseases, who are immunocompromised. So those are those people who may not be able to mount an adequate immune response to these vaccines that we're able to protect by getting our vaccines.
Absolutely. This is where the community works as a whole. And it's protecting our culture in many ways, because it's protecting our elder. It's protecting our people that have pre-existing medical diseases, including autoimmune diseases. And so, in effect, we're getting vaccinated not only helps you individually, but it helps the entire community, and it protects us. It protects our culture.
Can you answer for us today any changes or updates for individuals who are fearful of having an allergic reaction, such as anaphylactic reaction to these vaccines?
Side effects are common in up to 10% of people receiving these vaccines. That just means the body's actually working to produce antibodies. However, a true allergy, meaning a severe allergy, including anaphylaxis, where the airway shut down and potentially can extremely harm somebody, if not cause death. That's extremely rare. And so the current recommendations in the world, and specifically Canada, that if you have a known anaphylactic reaction to polyethylene glycol, then you should be offered the viral vector vaccine first.
So I think one of the major concerns that people have with regards to vaccine is often for those who have an egg allergy. That tends to be something that's included in many of our vaccines. However, it's not in our COVID vaccines. I think furthermore, I would say that oftentimes people may have, a reaction to vaccines that is completely normal, that they may deem to have been an allergic reaction. It's important to verify with your healthcare practitioner whether or not you did have a true allergic reaction, a true anaphylactic reaction to a previous vaccine or to any of the ingredients in the vaccines.
It's not uncommon to get side effects, but the far majority of side effects are not allergic side effects. There are common side effects, which are signs that your body's actually producing antibodies.
Just as a little anecdote, I know when COVID first started, and it wasn't something that I was considered, but my mother is really passionate about our language. She's a Mi'kmaq language teacher. And one thing that she was really concerned about when the pandemic hit was our elders and how each individual speaker who, has this wealth of knowledge. They're like libraries of our Mi'kmaq words. And if, every individual who passes on, she thinks of as like a library of knowledge being lost. And so I think that point, Rob, is really important because we really do need to protect our elders and our, our Mi'kmaq speakers, people who have the language and people who have, our cultural teachings. There's not many individuals who are still speakers. And so that's something that is very unique to our Indigenous peoples. And then also it's so much more concerning because we are at such higher risk with the virus. So. Very good point.
There have been multiple media stories released concerning blood clots, particularly with the AstraZeneca vaccine. This is said to be associated with extremely rare cases of blood clots that occur in the brain. These blood clots were found in approximately 1 in 100,000 people who received the vaccine. Is there a risk for developing a blood clot after receiving the COVID-19 vaccine?
The current evidence shows that between 4 and 28 days after a viral vector vaccine, meaning the AstraZeneca vaccine, 1 in 73,000 people that receive the AstraZeneca vaccine in Canada can develop what we call VIT, so vaccine-induced immune thrombotic thrombocytopenia, or a clot. Basically, you can get a blood clot in the brain, in the lungs, in the abdomen, or in the legs. Really, any vein or artery. And so people that have received the AstraZeneca just basically have to watch for symptoms of headache, chest pain, shortness of breath, persistent severe belly pain, or leg pain with swelling. So the instance of a clot in somebody taking the birth control pill is between 1 and 5 in 100,000. The risk of an individual getting a blood clot after an AstraZeneca vaccine is approximately between 5 and 10 in 100,000. So it somewhat increases the risk, not by very much, but somewhat.
And correct me if I'm wrong, Rob, with the mRNA vaccines, I don't think that we're seeing any increase in the number of blood clots with the mRNA vaccines, which would be your Pfizer and your Moderna.
Absolutely correct. The Pfizer, BioNTech, and the Moderna vaccines do not cause blood clots. However, there are increasing case reports in the world of the mRNA vaccine causing inflammation around the heart, called myocarditis or pericarditis. However, the numbers are very low in Canada. It's usually mild disease. And at this point in time, there's no true causation. It's just a small association.
How can we make sure our youth are equipped with the accurate and credited resources to be making informed decisions on their own health when it comes to the COVID-19 vaccines?
I think it's important to understand the power of artificial intelligence that's built into our technology. So basically, the more a person searches anti-vaccine literature or blogs or videos, the more often your device will lead you to that stream of information. So it's more important to talk to people that are knowledgeable about the risks and benefits of the vaccine and the disease, or to refer to websites that have valid answers to questions.
I think I would also add that, this is something that's not uncommon in our communities for a reason. There's a long history of experimentation on Indigenous peoples, and a lot of the mistrust with the healthcare system does stem from this. I think especially with the vaccines, a lot of people felt that the vaccine rollout had come too soon. They were very, critical of the fact that Indigenous groups were one of the first groups that were being provided the vaccines, and that was a little bit concerning for some individuals because of this history of experimentation on our communities. And so I don't think that this hesitancy or this fear is irrational. I think that there is, there's definitely history there. But I think what's important to understand is that we have been given an opportunity to protect our communities, and that's part of the reason why the three of us wanted to discuss this, because we understand where you're coming from, we understand your concerns, and we approach medicine and Western healthcare with with that lens. So I like to approach medicine with a two-eyed seeing approach that we're all familiar with. And I think that they don't necessarily have to be in opposition of one another. I think they can actually be quite complementary to one another. And so I think that using our traditional knowledge and Western medicine gives us that, that nice complementary approach to fighting this virus. And so I think that it's more of a fact of just recognizing the strengths in each way of thinking, and just taking the best of both worlds, essentially.
It's always safe to go to a website that's linked to a local children's hospital. For example, if you go onto the IWK website or the Children's Hospital of Ontario website, they will have friendly, well-written, appropriately written information for certain age groups.
I know that one of the questions was about the vaccines, asked about how vaccines are made. And I know this was a huge concern in my community when we held our information session, was how quickly the vaccine was approved and studied. And I think one thing that people don't recognize is that the technology behind these vaccines was actually in development for about a decade prior to us needing to create the vaccines for COVID. And also the full requirements that Health Canada has for a vaccine approval was followed. It was just on a timeline that allowed for the vaccines companies to provide information as they attained it. So it was kind of like a rolling approval. They were able to release information rather than letting the pile of all of their data pile up and then give it to Health Canada. They were able to do a rolling out type of approach where they would give, the required documents as they became available. So that helped facilitate a more efficient approval of the vaccine. So all of the same protocols were followed, and it was just in a more efficient way. And there's also a nice infographic that I can send you guys that Health Canada put out that just explains how vaccine approvals happen in just each step.
I think people have to realize that anything in life, any decision you make in life, you have to understand the consequences of that decision. And so you have to step back and you have to think to yourself, what are the consequences of me not getting the vaccine in this particular case? We've talked already that the consequences are not just potential death or serious illness or long COVID, which are prolonged, almost everlasting symptoms like bad headaches or kidney disease, but also the detrimental effects it could have on the elder and therefore our culture.
How can we make sure that the vaccine clinics are culturally appropriate? And have you experienced any of these vaccine clinics, and have any advice to anyone who is going to be hosting a vaccine clinic with Indigenous population?
I'm seeing more pop-up clinics in the bigger centers, including Vancouver. And these pop-up clinics, not just for First Nations, but for other minority groups, are set up in such a way that you not only know people, but they have pamphlets in their language. They may have other culturally appropriate descriptions of what the vaccine is and the benefits. They may have other things like food. That's always a nice addition to a meeting or a meeting place. So a culturally sensitive, friendly atmosphere that's educational and culturally appropriate.
Absolutely, and I was happy to see at least, I'm not sure what the case is on other reserves, but I know my reserve was opening up the vaccine clinics on reserve to off-reserve members, which was really great to see. And also I know locally here in Halifax, the Mi'kmaq Friendship Center was also a vaccination site offering vaccines to our urban Indigenous communities as well. So that's a great, safe space to go get your vaccination as an Indigenous person, and, just have, more of that community feeling and that extra sense of safety. So definitely. And I think that, unfortunately, we don't have a whole lot of providers from our communities. And that's just another thing that we need to continue to push, and hope that our younger generations will pursue careers in healthcare and help increase the workforce that we have providing care to our communities. That's a huge piece as well. We just need more manpower, and we need to encourage and empower our younger generations to pursue these careers. And then, we're able to provide more culturally safe and relevant care as well.
Here's a quote I just made. It'll be our motto, our team motto here. So, protect yourself, protect the vulnerable, protect your community and your culture. Get vaccinated.